Hello everyone. Today we'll discuss approach to a child with speech problems. So starting off with what are the normal speech development? So we'll look for normal speech development. At 3 months of age, the child or the infant responds to the parent's voice. Here the infant responds to parent's voice. At 5 months, child occurs to speak monosyllabic words. At 8 months, child babbles. At 1 year of age, so to remember easily, at 1 year, child speaks one word. At 18 months, the child can speak about 20 words. At 2 years of age, child speaks 2-word phrases. At 3 years, the child can speak 3 to 5-word sentences. Okay, this is a normal speech development. Next, we'll go to the types of the speech problems that the child can acquire or the child can have. So the types of speech problems the child can have are: first one is receptive. For example, a child can have deafness leading on to a receptive speech problem. Next can be an expressive type. Here a child can have a specific language impairment. Third type is phonological problem or phonological disorder. So here the child will present with unclear speech. Fourth, the child can have problem in the fluency. So the child will be having stuttering, it is stammering type of speech, or can have apraxia or dysarthria. Okay, these are the types of speech problems. Next, we'll go into the how you're going to approach in a stepwise manner. In step 1, first you have to see whether the speech is delayed or it has regressed. So is speech delayed or it is abnormal or it has regressed? Okay. In the second step, if the speech or the language milestone is delayed, okay, first you have to look for hearing. Is hearing normal or what? If the hearing is impaired, then you have to treat it with a hearing aid, or by using cochlear implant with speech therapy you can solve this problem. Next, you have to check for non-verbal IQ. This is second. You have to check for non-verbal IQ assessment. If this is abnormal, it can be a part of mental retardation. Okay. Third, you have to look for the milestones, social milestones. You have to look for social milestones. If the social milestones are regressed or the child is having any repetitive behavior, it can be an autistic sign. Then you can do MCHAT scoring, or you can do CARS. CARS is nothing but childhood autism rating scale. This is childhood autism rating scale. Then you have to treat it accordingly. If everything is normal, there is no abnormality, it can be a delayed maturation, or the child can be a late talker, have a delayed maturation, or the child can be a late talker. This is when the language is delayed. Next we'll see when the language is abnormal. Third step, when the language is abnormal. So how will you know the language is abnormal? So you have to assess the speech. So assessment of speech. In this you have 4 things. First one is semantics. In this, it is a knowledge of words and their meaning and how they are using it. It is about the knowledge of words and their meaning. Second one is syntax. That is use of the word in the sentence. It is use of the words in the sentence. Third one is prodocy. That is nothing but this is voice modulation. Fourth one is pragmatics. Pragmatics, it is ability to follow their social rules of conversation. That is appropriate use of the verbal and non-verbal language. Here it is the appropriate use of verbal and non-verbal language. That is ability to follow their social rules of conversation. If this pragmatics is affected, the child can have specific learning disorder. That is like dyslexia, the child can have when the pragmatics is being affected. So we'll see this in detail, okay? So when the language is abnormal, you have to look for whether there is an abnormality in prosody or pragmatics, okay? In this, the language is abnormal. First, you have to check for social milestones. In social milestones, if there is a difficulty in social interactions and non-verbal communications, it can be a Asperger's syndrome. The child can have Asperger's syndrome. This is nothing but the child will have a difficulty in social interaction and non-verbal communication. Secondly, the child will have a restricted and repetitive pattern of behavior. Will have a restricted and a repetitive pattern of behavior and interest. Okay, and first you have to look for this social milestones. Secondly, you have to look whether the child has having any underlying anxiety. That is, the child can present with a selective mutism. For example, like stage fear. When the child is on the stage to perform any speech or any rhymes, the child will not be able to talk by seeing the crowd. So the child will have some underlying anxiety. The child can have selective mutism. Okay. Third, whether the child is having difficulty in pronouncing a particular syllable. So whether the child is having difficulty in pronouncing syllables. So the child can have some phonological disorder. Fourth, I'll write it here, whether there is any oromotor difficulties with inconsistent pronunciation of words. So the child can hear with oromotor difficulties and inconsistent pronunciation of word. The child can have verbal apraxia. Fifth, whether there is problem in fluency. If there is problem in fluency, the child will present with a stuttering speech or a stammering speech. Will have stuttering or stammering if there is a difficulty in fluency. So when there are languages abnormal, you have to look for this social milestone, underlying anxiety, difficulty in pronouncing a particular syllables, or when there is with oromotor difficulties with inconsistent pronunciation of words, the child can have verbal apraxia, or when there is a problem in fluency. This is about the language abnormality. Next, third or fourth step here, whether the language is regressed. Where the child was speaking all the milestones, or child had been acquiring all the milestones correctly, at a particular point of time the child has lost the ability to speak, whether the language has regressed. So when the language has been regressed, look for when there is when the child is also presenting with a severe deterioration in mental and social functioning. So when there is a severe deterioration in the mental and social functioning, the child will have a childhood disintegrative disorder. Okay. Second, you have to look for whether there is a regression in the motor milestones, vision and cognition. Whether there is a regression of motor milestones, vision and cognition. Then the child can present with, this is called neurodegenerative disorder. Or if the child had a meningitis or an encephalitis, it could be due to a post-meningitic sequelae or a post-encephalitic one. These can be the reasons for child with the regression of the language disorders. Okay. Next, how we are going to evaluate the speech problems. Next is evaluation and investigation. First, when the language is delayed, you have to look for this hearing impairment. So you will be doing a hearing assessment. Next, you have to check for the IQ assessment to rule out whether the child is being mentally retardation or not. Next, you will be doing a MCHAT scoring or CARS. CARS is nothing but Childhood Autism Rating Scale. This is to rule out where the child is having autism spectrum disorder. Fourth, you have to do a psychological assessment. Fifth, you have to do an EEG or MRI brain. When the child's language is being regressed along with this motor milestone, mental and the social functioning deterioration. Okay. We have another syndrome called as Landau-Kleffner syndrome. In this, the child will present with a language regression. The child in the previously normal child. So, in a previously normal child can present with auditory verbal agnosia, with a loss of language skills, okay, and 70% of the children can present with the seizures. In 70% of the children, it is associated with seizures. In this seizure, they can occur in several types. It can be either focal or absence or a atypical absence seizure. It can be a generalized seizure, okay, or it can be a myoclonic one also. So it can occur with several types. Here, to confirm it, you have to take an EEG. This EEG should be taken when the child is in sleep. When the child is sleeping, only then you can see a high amplitude spike and wave discharges. It will be apparent only in non-REM sleep. So it will be an EEG apparent on non-REM sleep. The child will be having a high amplitude spike and wave discharges. Okay. Here MRI brain will be normal in this child. So the child, previously normal child, can present with loss of language skills with seizures. And in this you have to confirm it by using EEG. EEG should be taken, the child is having a non-REM sleep. So you will be looking for high amplitude spike and wave discharges. Next we will move on to the treatment. First, if there is hearing impairment or the hearing is impaired, you will be doing an amplification with hearing aid, or you will be using a cochlear implant. Along with this, you will be giving a speech therapy to the child. Second, when the child is having a cognitive impairment, that time you have to give a special education. Third, when the child is having an autism spectrum disorder, you will be giving a special education. Along with that, you will give behavioral therapy and occupation therapy. Fourth, when the child is presenting with a stuttering, you have to assess the type of stuttering. If there are more than 5-word break, if there are more than 5-word breaks in 100 words, for a duration of more than 3 months. This is mainly due to anxiety. It is a feeling of stress. It is mostly associated with feeling of stress. In this situation, you have to give the speech therapy. So these are best treated with the speech therapist only. So in the speech therapy, what are the components it should contain? Here, there should be a reduction in the parental criticism. Second, improving the self-esteem. You have to give a positive encouragement to the child. A positive enforcement should be done. Third, there should be a timed syllabic speech. It should be, the speech that you are going to practice should be a slow, loud and a firm one. Then you can do a bedtime reading to the child. Bedtime reading to model a slow and fluent speech. Okay. Drugs are used in rare situations. The drugs that can be used are haloperidol, risperidone and olanzapine, but these are used only in a rare situation. Fifth, when the child is having phonological disorder or when the language that they have pronounced is abnormal. When the child is presenting with a phonological disorder, here the treatment is also a speech therapy with training of tongue and lip position. Sixth, when the child present with the Landau-Kleffner syndrome, as I told earlier, here the treatment is you give anti-epileptics and steroids. Okay, so this is the overall view about how you're going to approach a child with a language problem. So you have to first see whether the language is delayed, abnormal or regressed. If it is delayed, you have to do these, and if it is abnormal, you have to assess the speech assessment should be done, whether it is in semantics, syntax, prodosy or pragmatics. If it is have been regressed, then you look for mental and social functioning, other milestones should be looked for, or you have to ask history regarding any meningitis or encephalitis previously. Okay, so this is about the overall view. Thank you. I hope you have understood this speech problem, how we are going to approach. Okay, thank you.